Welcome to our newest episode of the Lebanese Physicians Podcast. And today, our title is actually Are Hospitals in Lebanon Prepared for a Mass Casualty Event? And my guest today is a good friend of mine who I've worked with in the past, Dr. Mariana Helou, who is currently the chief of ER medicine at LAU Medical Center Rizk Hospital in Achrafieh, Beirut. Dr. Helou finished her medical school at the Université Saint-Joseph, I guess, I don't know, with my French. And then she did her ER medicine in France. And afterwards, she completed a fellowship in disaster medicine in Italy in 2019. And she has been involved in a number of disaster events that have happened in Lebanon in the recent past. Welcome, Mariana, to the podcast.
Hello, Khalil. Thank you for inviting me. It's a pleasure to see you and a pleasure to do this podcast.
So I'm going to start with that bad day, August 4th, 2020, the Beirut port explosion day. And I know I was still there at the time. And explosion happened. It was a huge mass casualty event. I remember the ER being filled with patients, some big trauma, some small trauma and stuff like that. How ready were we for such an event when it happened at that time?
It's a bad thing to remember that day. I was on duty. In fact, we thought that we were prepared. We had written our emergency preparedness plan. We had revised the plan at many times, but we never expected that we might have such a disaster. It was really beyond our capacity, and it was beyond any emergency plan. After that day, we knew that we were not prepared. A lot of things in the plan failed. The number of casualties that we received were much higher than the number expected in our plan, and I think in any plan in any hospital elsewhere. We saw around 400 people on that night. Most of them came the first hour or 2 hours. So 400 in an hour or 2 hours for an emergency with 12 beds, I think it is a disaster.
Yes, exactly. And I remember the patients at the time came, some of them had small cuts that needed to be attended to, but a lot of others had more severe trauma. So people had to shift and see who to take care of first at that time. And then I remember the other part we're not prepared to, was the patients were numbered. And so the CT scans were numbered at the time. So we couldn't, it was hard to figure out which patient is for which scan. So what do you think was done right at that time, or what do you think was done wrong or could have been improved upon since that time?
Yeah. In fact, we faced a lot of challenges, and I wrote many articles about this because, you learn from your mistakes. So the challenges we faced were the things that we worked on to update in the plan. What we did well, maybe the only thing that we did well is that because we had a small emergency, we used all the hospital space for the patients because, the 400 patients could not accommodate in the emergency and not even in the parking of the emergency. And so we used the other areas. We transferred patients to be seen in the clinics. We opened the door in all the hospital clinics, and the patients, the green patients, the patients tagged green, which are the patients a little bit injured, they were seen in areas outside the emergency. And we kept the emergency only for the patients that were really sick, that were triaged red, that needed immediate care. Right. And this is one thing we did well to help us just to triage the patient. The other challenges were too many challenges. So first, we had no crowd control. All the people and the families and we couldn't recognize who's the patient, who's the family, who's visiting someone, who's looking for someone. So everyone went inside the emergency, and it was a chaos inside. Second, communication. We could not communicate between us. I was not able just to know whose surgeon arrived to the operation room, and I couldn't contact anyone to know who's there. I couldn't know who's in the radiology reading the x-rays, reading the CT scans. So communication failed. And of course, we had problem with triage because a lot of patients arrived immediately after the blast, and most of them entered the emergency, and we were not able to do adequate triage because they were all inside. And so usually better to do it outside, just to split the patients into urgent, not urgent. We couldn't do this neither. So these are the main challenges that we faced. And the last challenge was the patient identification. Many patients came. We couldn't register them. We didn't have time. There was no one to take their ID. And many of them came, they were treated, they left, and they came to for follow-up after 3 or 4 days. And we find out that they came to the emergency, they were treated, and no one asked them their name or the identification papers. And this is why we think that maybe we received more than 400 of people, because many of them came and left and were not registered.
Yeah, they were not recorded that they came.
Yeah.
So basically, after this, I saw that you've been involved significantly in disaster medicine. You've published, as you said, you've published quite a bit on the topic, and you have been involved in multiple conferences in the Mediterranean area and Europe regarding the topic. So can you describe your involvement, and can you also comment on like how the European societies and countries are interested in this topic?
Yes. In fact, I did a subspecialty in disaster medicine. I graduated in 2019. It's the EMDM, the European Master in Disaster Medicine. It's in Italy, in Novara, small city.
Nice city.
Yeah, it's a nice small city. Yeah. So after I graduated, I was thinking, I mean, I like this subspecialty, but I don't know how I'm gonna use it. And then August 4 came. It's not good to say that, I found something useful in what happened for our emergency plan at the hospital, but also for myself, because a lot of European societies were involved in this and were surprised about what happened. And for them, it was a huge thing, because when you talk about disaster, a disaster can be a small blast with, for example, 10 or 15 people injured. A lot of terror attacks happened in Europe lately, and most of them were 10 or 20 people, or maybe maximum 50 people were injured. But no one expected that you might have such a disaster with over the country around 6,000 people injured with 200 deaths. So it was a huge and a massive disaster. And this is why they were all interested about really what happened on that day and how we could manage. We do not forget that we're a small country with a lot of hospitals not prepared, maybe staff also not adequately prepared. And so they were interested about how really we could manage with these casualties. And this is why I was invited just to speak about the blast. I did many webinars. I presented this also at the USM Congress, and the year after at the also IFM Congress. There were international congresses about emergency and disaster. I had to speak about this, and also this made me work more with the disaster with my university, with the master in disaster medicine. So I teach with them. I'm a faculty with them. And so I just do, of course, I present about what happened in August 4. Sometimes we do like tabletop exercise about the blast, like all the casualties coming and you have a small emergency and how would you deal with all this. Also, I am a mass casualty management trainer with the WHO. So it's a certificate from the WHO Academy. I also train the hospitals for this. And so, you just you start with a little and then you expand little by little. And that's it.
And do you think the Ukraine war had an impact also on like the interest in Europe and in this topic, or it was all the terrorist attacks that were happening before?
You mean if the European were interested with this?
I know. I think they're interested in the topic and in disaster medicine, but their interest has it increased also due to the Ukraine war? That's what I was asking.
Yes, because you have a disaster and then it's they forget about it, and then you have the other disaster coming, they forget about it, they don't forget because another disaster is also coming, and then they just remember you're having a disaster after a disaster. We had the COVID pandemic, everyone was interested, Then we had the August 4th, the blast, and after the Ukraine war, and of course we had a lot of floods and the earthquake in Turkey. A lot of things happening after. And when any disaster that happens, they just remember the old thing that also happened, and they will just need to talk about it again. So
Right. And so Lebanon has passed through, I mean, with August 4, but then there's been periods of instability, and now more recently, there's been the war in the south with some bombings and stuff like that. And there's been a lot of discussion about, are the hospitals in Lebanon prepared for this or not? And I know you've done some work at LAU for preparedness. So one, I'm going to ask you first about LAU, and then we'll ask about the other hospitals in Lebanon. So do you think LAU right now is prepared for a mass casualty event or a disaster event if it happens? But we're all hoping it's not going to happen. But just are we prepared for this, or are you?
yeah, I do think and I hope that we are really prepared. I mean, we worked a lot on our emergency plan, a lot of meetings, a lot of work just to make it really, nothing is perfect, but we just make it the best we can with the knowledge that we have. Of course, now that what I can say is that, of course, now we are ready for any disaster better than in 2020 when the August 4 the blast happened. So we're now really much better prepared. And the good thing is that we conducted a drill. And writing the plan is not enough. The drill is a good thing because you do the drill, you just how you do if anything happened. And this is a good idea because we're doing also another drill planned in February. So we will keep conducting drills to make sure we're ready. I think we are ready. Yes, we hope nothing will happen, but we are ready.
Yeah, and obviously you have the equipment and everything available in case of such an event.
Yeah, we prepared. We have all the equipment ready in small boxes, already in the store, in the pharmacy and in the store. Whether anything happens, they come immediately to the emergency or to the area for the other patients.
And such events obviously require like collaboration between the different emergency departments in, let's say, Beirut and maybe in the other areas of Lebanon. So is there any collaboration happening right now? And what's the involvement of the Ministry of Public Health and
Yeah, the ministry is working on training the hospitals. Lately, they started to do a lot of trainings. They are training the emergency staff, they are training the doctors, they are collaborating also with the WHO to do the training that I was talking about, the mass casualty management training. So they are trying to do the maximum they can. Also, they are training the people working in the emergency for the white phosphorus because now with the bombing, what they are using in the south. So they are just training the emergency team on how to deal the clinical management of the casualties that we might receive. This is a good thing that they are doing now. But the main problem is the communication. We do not have a plan or a checklist for all the hospitals to make sure they are all ready. Each hospital is working on its own to do its own plan and to train its own staff. This needs to be worked on.
Yes, basically what you're saying is that each hospital is doing their own plan, which may not necessarily be the same plan that another hospital has.
Yes.
Yeah. Mm-hmm. So it's not like...
Which also may not be adequate or may not follow the guidelines but this is what should be worked on better for the future.
Right. Because what you're also alluding to, I think, is communication, because if the ER start getting filled with patients, you need a system to know, let's say this ER is completely full right now. We need to take the ambulance or take the patients to the next ER, to another closer trauma center.
This is what happened, the problem. This is what happened in August 4, and this is what's going to keep happening. if you do not have communication, you will have patients in one of the hospital that you cannot transfer. For example, two of major hospitals in Beirut were destroyed in August 4,
Right.
but we didn't have adequate, like affiliation or communication to be able to transfer their own patients to the other hospitals. And this should be worked on. If you have a disaster, if I receive, for example, at my hospital 500 casualties, but the hospital beside me received maybe 50 casualties. There's no way of communication just to let them know so I can transfer from my hospital to them maybe 200 patients just to help.
Right, exactly. And that's a big issue. And that's probably something that maybe the hospitals would need to work on, or the ministry, I guess, would need to work on to have a system of
Yeah, maybe at the next stage, the ministry could let the hospitals collaborate among others for this.
And
This is a part of the national plan, no? Because each hospital does its own preparedness plan, the hospital plan, but then you will have the district plan, then you will have the national plan, and this is what's the national plan.
Okay, so this, I guess, this is being worked on, but it's not reached fruition yet, right?
I think it is worked on.
You think
Yeah.
so?
No, I mean they are working on the national plan, but
Yeah,
I'm not sure if the part related to the communication among the hospitals
right.
is really a key point that they are now discussing. Maybe in the future, I don't know.
Yeah. And I'm sure there's a also society for emergency room physicians in Lebanon, right?
Yes, we have the Lebanese Society of Emergency
Medicine.
Physicians.
They're probably discussing this issue too, right?
Yes, they are discussing, but as I told you, since even if I discuss it with all the emergency physicians among the country, if there is no rule for all the hospitals within the ministry or within a higher authority, um, nothing would change.
Right. And are you, like, in your role, I guess, because you're advising different hospitals now on disaster preparedness? So are these hospitals in Lebanon, or hospitals outside Lebanon, or both?
Soon we will be conducting a training for the Beirut. I hope we will keep doing it here in Lebanon because I would like to help in my country. I mean,
Right.
even if the training I did it outside and I am able now to train in Europe, but of course I would be more beneficial for my country to do it here in
Right.
Lebanon.
Right.
So yeah.
So a couple more questions for you. One is, do you think the hospitals in the peripheries, let's say the hospitals in the south or other smaller areas of Lebanon, are they prepared for mass casualties?
I mean, I think they might be prepared, but I am sure they are not prepared enough. Like you can always have a surprise if you do not, test your plan, revise your plan. It might fail, and it's not something bad. I just say it. We failed in many things on August 4 because the plan was not tested, and this is why we amended. So I think a lot of hospitals they do have their plan, but their plan might not be adequate for a disaster. Some of them maybe I don't know if they just if they were lucky enough, their plan might work. But when you have a disaster, you don't know what you might expect. So we never know.
Right. Yeah. So it seems from what I'm hearing from you is that you're doing training in disaster medicine, but currently it's more in Europe than it is in Lebanon, and you would like it to increase in Lebanon. Am I correct?
Yes, true.
Okay. And do you think that will happen? So what are the plans for that? And do you think you guys would be able to start doing more intensive trainings in Lebanon?
What I think is that it would be good to train all the hospitals, starting by the small hospitals. The small hospitals in the areas like in the south, in the north, and Bekaa, outside Beirut, because uh, most of the AR physicians they work in private hospitals and in Beirut. Little of them work outside. Like I have some colleagues in the north, some colleagues in Bika, they are doing a very good job, but they might be alone because you will have one ER physician and four other doctors helping them, but they are not ER physicians. And some of them can be, for example, still studying as medical and medical specialty.
Right.
And so this is why everyone working in the emergency should be prepared and trained, because maybe the ER physician won't be in the emergency when something happens. Maybe the fellow or the student, the resident, another person will be on call when the disaster strikes. This is why we need to prepare these small hospitals that are really far in the country, like in the borders, starting by the south now, because the problems are in the south, then to the north, and and finishing by Beirut.
Yeah.
But I think if you do the good thing in the training, you standardize. Like, when you train the same training for a lot of hospitals, the plans will be almost similar, because a lot of hospitals will amend the plan to look similarly. And this will be good, this is a good start.
Yeah, because also as you discussed too, it's not only the physicians who need to be trained; it's also the nurses, the respiratory therapists,
The whole ER team, the whole
the
ER
trainees, the whole ER team needs to be trained,
Yeah.
and potentially the hospital too, because you need to be able to accept patients like afterwards into the hospital, like the intensive care unit and all this other stuff. And so, Mariana, what are your future plans? I guess now you're becoming a star in Europe. So what are your future plans?
I don't know. I mean, whatever comes is good. It's not, I don't have plans, what I focus now is mainly on my academic work, because I work in university hospital, and my main focus is now training, helping students, thesis supervisor, doing some research. So mainly this part. I hope no disaster happens, so I won't need to do the other part, the disaster medicine. Mainly this for now.
Yeah, so I think basically to summarize, I think what we discussed, it seems like hospitals are more prepared now in Lebanon than they were back in 2020.
Yes, of course, because they are afraid that
Right.
something happens, and because they saw what happened in August 4, and they don't want to do the same mistake again, starting by us.
Exactly. Exactly.
Yeah.
And so I think this is a good thing, but the thing that needs to be improved upon, I think soon is communication between the hospitals to help with the preparedness and help with potentially being able to send patients to the hospital that's the least busy during a disaster.
This is the coordination center that should be worked on. But we had the coordination center with the Lebanese Red Cross. But for example, on August 4, they didn't have time to coordinate. I mean, but all of them they went to the blast area, and they were just transporting the injured to the fastest way possible to the nearest hospital. I mean, they didn't have time to coordinate, to see how many casualties in each hospital, and this is what happened. So
Yep, I agree. All right, Mariana, thank you for being on the podcast. It was great talking to you again.
thank you.
And I guess maybe I'll see you soon in a couple of weeks in Lebanon.
Hope so. Nothing will happen. You can come.
Yeah. All right, thank you.
Thank you. It was good to see you. Thank you.